Okay, so good morning, everyone. I'm really excited to present this topic this morning, and that is how to incorporate Take Shape for Life into a busy medical practice. Or maybe you don't have a traditional practice, you just have a busy life, and you'd like to learn how to be more efficient in incorporating this business model into that busy life. And I'm here to attest to the fact that it can be done. I became a Take Shape for Life health coach in 2006 when I was practicing oncology. And I did have a really busy practice. So, really, to be completely transparent, for the first 3 years, I was so paralyzed by my busyness that I rarely talked to anyone about the Take Shape for Life program. And then as time went on, I realized what I had in my hands. Such a powerful tool that would help patients get healthy. And some of you know my background, some of you don't. But my practice was all about breast cancer. And so as time went on, I kept seeing younger and younger women with breast cancer. And I certainly became aware of the tremendous link between being overweight or obese and breast cancer because of estrogen dominance. And estrogen, high circulating estrogen levels in women who struggle with weight is the precursor for breast cancer. And so I went on a mission to share Take Shape for Life with my patients once they finished their treatment so that I could help them reduce their risk of recurrence, reduce their risk of a second cancer, reduce their risk of other major diseases that we know are associated with obesity. So that was my practice. And I want to share too that I loved what I did. I went into work every day. I gave my heart and soul. I loved those women. I got to connect with their families and their spouses. So I couldn't have picked a more perfect specialty. However, I wanted, as time went on and I became older, in my 50s, especially mid 50s, I knew I wanted more out of life. I wanted more balance. I wanted more time with my family. These are my children here. I wanted freedom. And so in 2011, I decided to jump off the cliff and become a full-time health coach with Take Shape for Life. And there was a big grieving process there because it was a big chapter to close. But now I have such an extraordinary life, and I'm helping a lot of people get healthy. And there's nothing more precious than having time to spend with my children and the people that matter most in my life. So what are you looking for as a health professional? Many of you are looking for health for your patients. You're looking for health for your practice. Maybe there's a financial struggle there and you're trying to fill in that gap. Health for yourself, less stress, being able to sleep better at night. I know I suffered from insomnia for decades because I would go home after work and worry about the patients and worry about my schedule for the next day. And now I sleep soundly. It's like a miracle. Maybe you're looking for time for yourself and time for those that you love, having more control over your day, and certainly having the freedom to organize your life around the things that matter most. So where are you and where are your patients in our trilogy of optimal health? So I love this about our business model. We call it the trilogy of optimal health, not only a healthy body, but also healthy mind. And that can be the most important peace of mind. And then having healthy finances as well. So we offer all three of those pieces in our Take Shape for Life model. And in terms of health professionals, the timing couldn't be better because there's so much going on in healthcare today. Physicians have less autonomy, reimbursements are going down, overhead is going up. Starting in October, we have the new ICD-10 codes that are going into effect, and I'm going to let Dr. Eisen speak to that in a bit. We have more regulation, longer hours. The stress never seems to go away. Now everyone has been forced to use the electronic medical record. Even physicians that are older, who don't have a lot of technology skills, and the electronic medical record has been a nightmare, adding 1 to 2 hours to their already too busy day. And then we have younger physicians who are getting out of school, both chiropractic school and medical doctors getting out with a lot of debt, $100,000, $200,000 or more of loans for their education, and feeling the stress of how are they going to pay that back. And then at the other end of the spectrum, older physicians feeling the burnout that so many physicians are feeling today. So the wonderful thing about Take Shape for Life is that we have an extraordinary program that we can offer our patients. It's really turnkey, it's comprehensive. It's not just about dieting or losing weight. It's about helping our patients create optimal health. And we have these wonderful tools to help our patients be successful. We have our Habits of Health system, a wonderful book and workbook written by Dr. Anderson, the co-founder of Take Shape for Life. And we have the other fabulous tool, which are our meal replacements. The program is not expensive, so it's affordable for most everyone. So it starts there with our program. And so what we offer our patients is the opportunity to transform their lives. And I love these before and after pictures of Linda. Linda is one of our Take Shape for Life clients. She lost 80 pounds on the program, and now she's wearing skinny jeans and feeling fabulous and helping other people, paying it forward with the people that she loves and cares about. So the most important piece of our business model or our program model is the health coaching, walking alongside a person and guiding and supporting them. I always say as a health coach, I love support and guide people. That's what I do each and every day. And we have all of these wonderful tools from the company that helps us guide our patients in a very efficient way. So we have the meal plan, but we also have weekly support calls on Monday nights from a registered nurse, on Wednesdays from a physician. I do some of the support calls on Wednesday nights, alternating with other physicians. We have a support call once our patients get to their goal weight. We have a small army of registered dietitians at the home office that can work with our patients one-on-one if they have questions and so forth. So what I want to do this morning is primarily help our health professionals learn how to share this program in their offices. So how do we get the word out about the Take Shape for Life program if we've decided to be a health professional provider? One thing that I find I think is very important is for the receptionist or the person that greets the patients as they come in to tell each patient, hi, Kathy, how are you doing this morning? So happy to see you. We have a new program in our office that helps get weight off fast and safely. If you'd like to learn more about our program, let me know, and we will schedule an appointment for you. To get the word out, you might have a digital frame on your front desk with before and after pictures where it's toggling, from one before and after picture to another. Maybe having, if you're one of those offices that has a television in the waiting room, instead of playing soap operas, have a continuous loop DVD about the program playing on that television set. So those are a couple of ideas there. This is a fabulous idea from Kelly, who is a nurse practitioner in Omaha, Nebraska. And Kelly owns her own primary care practice. So what Kelly has in her waiting room is this whiteboard. And you can see the picture on the left. When she first started using the whiteboard, she had her patients collectively had lost 343 pounds. But every Friday, Kelly updates the whiteboard with the new number of what her patients have lost. And this is one of her patients. His before picture, his after picture, just the amazing transformations that happen in a medical practice if we venture out and let our patients know about the wonderful program that we're now offering. In the exam rooms, you can have before and after posters. The company has some before and after pictures. I'm personally hoping that they will update the posters. I think some of them look a little tired, but nonetheless, they have been very, very effective for many offices. So one of my OBGYN health coaches has the posters on the back of the door. So when the patient is in the exam room, the door is closed, the patient sees the before and after poster and can ask questions. Gee, what is this about? And you can just, tape them up there or have them framed in simple frames. One of my health coaches, who's a dermatologist, when her assistant puts the patient in the room, the assistant will say, we have a fabulous program that we're now offering for weight loss, and I'd love for you to see this 5-minute video. And she puts it into, or starts it up in the computer that is in every exam room. Having body mass index cards with bullet points of the program in the exam rooms and in the waiting room can be a great way to pique some interest. And then as a physician or as a health professional, with every patient, reviewing their BMI when they stand on the scale, showing them where they are on that BMI chart. That's the reality check. And explaining that excess weight is a huge risk factor for disease, but you have a program that can help that patient. So these are the BMI cards that I use as a handout. So the front of my card has the reality check, so patients can go down, find their height, find their weight, and where the two intersect is their body mass index. And then I have my information on the front. And then on the back of the card, I have the bullet points of the program. And again, my contact information. Very powerful as a before and after picture. That really speaks to people. And these cards are not expensive. They're the ones that I order from my wonderful person, Terry Jordan, and I have her phone number there, 18 cents a piece. So they're not expensive. It's a heavy stock paper. They're glossy, very, very professional. I also have business cards that I order from Terry. Her pricing is just extraordinary, $40 for 1,000 business cards, and these are double-sided. So again, Terry's contact information. But really, with sharing the Take Shape for Life program, the most important thing that we can do as a health professional is to make a strong recommendation. And sometimes I hear from physicians, I don't want to offend my patient. Are you kidding me? It's like offending your patient when they come into the office with strep throat. You know, they come into the office, they've got a sore throat, their lymph nodes are enlarged, and it's not offensive to point out to them that they have an infection and that the solution is an antibiotic. The same thing, patients come to us to get healthy. They don't come to us to stay tied to their prescription drugs and their diseases and their diagnoses. And so really changing our mindset. So the most important thing we can do is to make a strong recommendation. So John, you've got to get your weight off. It's the reason your back's hurting. Your weight is the reason you have diabetes and high blood pressure. That weight that you're carrying is affecting every organ system in your body because of inflammation from that obesity. And the good news, John, is that we now have a great program that can get your weight off fast and safely. Is it okay if I have Ashley? She's the person in our office that helps patients with this program. Is it okay if I have her schedule an appointment with you to see if the program's a fit for you? But the strong recommendation from the health professional is the number one reason why patients will be interested. So you can have all the materials you want in your office. You can have posters, you can have the DVD playing, you can have the BMI charts, but unless we recommend what's best for them, they may not be interested. They may not realize how important it is. So getting the referral to whomever is helping you in the office, a great way to facilitate that is to have these little referral pads made up. And these referral pads, the one that I personally use for myself, these referral pads are a 1/4 page size. So they're the same size as a standard prescription pad. And I just have my information in there, but more importantly, a blank for the patient's name, their phone number, their email, the best time to be contacted. And if I'm working with another health professional office, then I have a blank for the referring provider, because some health professional offices may not want to incorporate this into the practice. They may not feel that they have time or energy or the staff. And so you as a health coach could work with health professional offices and simply get referrals from them. So this is a very efficient system that can help to capture those patients that might be interested. So the health professional simply has to say, make the strong recommendation, and Mary, fill out this referral pad. Leave it with the receptionist. I don't know why those red lines are happening. Sorry. And then Ashley, or whomever the helper is, will call you for a phone consultation. Or Ashley will schedule an appointment for you to come back into the office, whatever is most convenient. She'll explain the program, and if it's a fit for you, she can help you get started. So a phone conversation or getting the patient back to the office is the goal with the program. It really only takes 15 or 20 minutes. And then when the helper calls that patient because the appointment has been made, is this a good time to talk? Is this still a good time to talk? I'm really excited to share our program. I need to ask you a few questions to see where you're starting, where you want to go, and then I'll go over the program if it's a fit for you. And we have this profile form, or like a patient intake form that we use. Even though all the information is in the chart, I still think it's important to fill out these forms and keep them separate from the chart, because you can end up losing, the information in, 5,000 health professional charts. So I have a separate notebook that I use for all of my patients that are on the Take Shape for Life program. And then presenting the program is super easy. We have bullet points in some of the materials that you've gotten with your business kit if you're already a health professional. And I just simply go over these bullet points with them. It keeps me focused. I don't talk too much. And it's super simple. And then discussing the cost. The program is cost neutral. John, while you're doing the program, this becomes your grocery store. It's $12 a day. For $12 a day, you're going to get everything you need except one meal that you're going to provide yourself. And we describe that meal as a lean and green meal that you can have with your family in the evening, or you can order at a restaurant. And, John, the coaching is free to you. You're just paying for the meal replacements and the program materials, and the coaching is completely free to you. Now, of course, if a patient comes into the office for office visits, and again, I'm going to have Dr. Eisen explain how that works, then there's a typical charge for them to come in, just like they would for a visit to check their high blood pressure or their diabetes. And John, the program is month to month. You're not signing a long-term contract. The cost is $350 for the first month. That includes a whole month of food and the program materials. And then making the invitation. Try it for a month. In a month, you're going to know if this is the program for you. And all we need is your credit card or debit card. We're going to set up your account. And then when your food arrives, UPS at your home, all you have to do is call us and we'll help you get started. So it's super easy. And another section that I'd love to cover, because this is really one of the most important parts, and that is who does the coaching. Because as Take Shape for Life health coaches, that's what the company pays us for. It pays us for coaching. And I feel very strongly about this. It's not fair to sign up a patient or a client on our program and then never call them or never follow up or never help them along. That's what they've signed up for, is the support and the guidance. So we are getting paid actually extremely well from the company. So who does the coaching? Actually, when I saw this business model and what this could provide for me in the future as a plan B, I was not about to leave my future in the hands of an employee, even though I had employees. I own my own practice, but I decided I was going to coach my patients myself, because it really doesn't take very long. But let me show you some other coaching models for those of you that are maybe cringing and thinking, I've got too much on my plate. There's no way I can coach patients on this program, even though it doesn't take very long. So here are some other models. A doctor and the spouse. When I work with a health professional, I always say, what does your spouse do? Many times it's a male physician, although not so. A lot of my health coaches are actually female physicians. But I always say, what does your spouse do? Because if the spouse is a stay-at-home person, that could be the perfect person to link arms with and help with the coaching. And I have an endocrinology office where the physician, his wife, is the coach, and they have done phenomenally together. In the first year that they offered the Take Shape for Life program in the office, they generated over $80,000 in additional revenues. So that has been a win-win. The physician and an office manager. I have an OBGYN health coach where his office manager, Sharon, is a health coach. She became a health coach, and she does all the coaching. And the way that she gets compensated for that additional time is that when the doctor or she identifies a patient that's a candidate, the first patient goes under the doctor, the second patient goes under her. So they are both sharing the additional revenues, but she's doing all the work, and that model has worked beautifully as well. I have a managed care group here in St. Louis where they hired and trained specific employees to be health coaches. So once they hired the first person and that person was saturated, then they hired a second person. So dedicated employees that would do the health coaching. So that's another model. Another model could be the health professional and their sponsor. So let's say I sponsor a health professional and that person says, I see the value to this, but I absolutely can't squeeze out another minute in my day. So we may set up a model where that physician refers to me, I put one patient under that physician, and the next one goes to me. The next one goes to the doctor, the subsequent one comes to me. So doing an every other one, we've got some health coaches that are doing that. And then, as I already mentioned, the physician or the health provider being the primary coach. So the coaching is crucial, and that's what we get paid for. So what do you earn from just, adding a little bit of additional time to your day and offering this program, especially if you're the one doing the coaching? Well, if you had 30 patients that were on the program in a given month, and again, some of these patients are going to be on the program for many months, maybe even a year or more, as they're losing their weight. So the average order, let's say it's $340 a month, and the monthly income from those 30 patients would be just over $3,000. If you multiply that times 12, there you have almost $38,000 a year, plus some bonuses that the company gives us quarterly, $1,000 quarterly in bonuses. So there's an additional $40,000 a year. Let's look at 50. If you had 50 patients per month, so that would generate a little bit over $5,000 a month, which would translate into an additional $65,000 a year into that practice. Now, that's significant money if you're a nurse practitioner with your own practice, if you're a family physician with your own practice, because primary care physicians simply don't earn all that much. So $65,000 a year is a lot. How about 100 patients? Some will be new on the weight loss phase. Some, maybe just ordering for maintenance, because our patients can continue to order even after they've gotten to their goal weight. So let's say they're ordering on average $250 a month. There's almost $8,000 a month in income, which translates into almost $100,000 a year in revenues just from our patients. So my challenge for health professionals who are using Take Shape for Life in their practices, just sign up one patient, maybe two patients every time you're in the office and you have people on the schedule, just one or two. That's not going to jam up your schedule. You might have 30 obese patients on the schedule, but you don't have time to talk to 30. but you could talk to one or two. At the end of the month, you'll be at the highest commission level of 31%, earning about $3,000 a month. That is so doable. And then it goes on from there. The other thing that I wanted to mention is getting out of the mindset of, I don't want to hurt my patients' feelings. They know they're overweight. They know they're obese. They're watching television ads and ordering crazy stuff that has no benefit. They're wasting their money on these corsets that are supposed to squeeze out the fat and doing stuff that doesn't even make sense. So think about our Take Shape for Life program, not about selling. It has nothing to do with selling. It's about saving people's lives. And this is the data from the Cleveland Clinic. It shows that if you take someone who's obese and you get them to a healthy weight, all of these medical conditions improve in these gigantic percentages. It's just astounding. So type 2 diabetes, 83% of the time, patients can reverse their diabetes by getting to a healthy weight. Look what happens with 5-year mortality of any cause, 89% reduction by getting to a healthy weight, and so on and so forth. So this is about saving lives, and that's what gets me motivated every time I share Take Shape for Life with people that are hurting. So as a health coach, you are able to carve out a new path. Like for myself, now that I'm retired, I left medicine in 2011. I don't have a beeper. I don't have any night call, no emergencies. I'm not selling. I don't have any inventory. I work for myself. I'm the CEO of my home-based business. I have no managed care, no ICD, soon to be 10 codes. I'm not even practicing medicine. I don't carry malpractice insurance. I'm simply loving, guiding, and supporting my clients and my patients to health. So I am going to stop there and open it up for questions.